Hi, it's Dr. Hood. I want to talk about obesity and cancer and why that relates to you taking control of your health, getting lean, getting fit, eating correctly, doing the right exercises. There was a campaign last year by Cancer Research UK to highlight the fact that obesity is a risk factor for developing cancer, similar to how if you smoke more, you have a higher risk of cancer. If you're clinically obese, you have a higher risk of cancer. It gained some negative press attention. Things like fat shaming, putting pressure on people who are overweight. When it wasn't really, it is a scientific fact. If you are clinically overweight, you have a higher risk of developing cancer. Doesn't mean you will develop it. It just means a higher risk. What's interesting also in that patients who already have cancer, those who are overweight to start off with, or clinically obese to start off with, have a higher risk of the cancer coming back years later, even after surgery, even after chemotherapy. And actually, there are some trials looking at cancer patients to see whether after treatment, whether changing their diet to help them lose weight reduces their risk. There are some studies that have shown that, but there are some current trials in a larger number of patients to try to prove that definitively. And it's likely to show that if you eat the correct diet and lose weight, you have a lower risk of your cancer coming back. And why is that? What's my point? The point is excess fat on your body. If your diet is full of processed foods, full of very calorie rich and nutrient poor foods, excess fat on your body is not inert. It's not just excess fat that you could do without. It's actually metabolically active. So in with regards to cancer, one of some of the hypotheses as to why excess fat increases your risk of cancer or cancer recurrence are things like the excess fat is associated with increased levels of inflammation. Also, the excess fat releases things known as cytokines or adipokines, which are messengers that stimulate cells, stimulate inflammation, stimulate growth of cells, in particular small cancer cells that are released when you first have cancer, and also the fat releases things like insulin-like growth factor. Again, these are growth factors which again create an environment that help cancer cells to grow. And a lot of these processes also increase inflammation that leads to other disease processes such as stroke, heart disease, and even dementia. So the excess fat on your body isn't just there getting in the way, not letting you put your clothes on properly, for example. It's actually metabolically active. And it's likely that it's not just the actual excess fat that increases your risk of cancer or other chronic diseases, but the diet that causes it. So the typical Western diet is highly inflammatory. It contains a lot of processed vegetable oils, which have increased dramatically over the last few decades, and also processed nutrient-poor carbohydrates, devoid of any nutrients, and a diet which is poor in nutrients, poor in good quality proteins, in healthy fats and micronutrients. The typical Western diet. So the diet combined with lack of exercise, combined with excess eating, causing fat deposition, leads to an excess of fat cells which are metabolically active, which will stimulate multiple cells and organs throughout the body, and then with other factors such as your age and your environment and your genetics will increase your risk of developing cancer and other chronic diseases. Now, this video isn't about it's not supposed to scare people, but it's just to highlight an important fact. What leads you to want to take control of your health? You feel unfit, you feel fat, you don't like maybe what you look like, or what your clothes aren't fitting, or what others have commented on you. Now, some of these are valid reasons to take control of your health, some are less, because a lot of it comes from pressure from social media and so on. But whatever it is, something leads you to want to take control of your diet, to take control of your exercise, and then you realize actually, if you modify your diet so you are focusing on nutrient-rich foods and moving away from highly inflammatory foods, which make up a lot of a typical Western diet, then not only will you burn fat and get lean, not only will you improve the quality and function of your organs, but you actually will reduce inflammation in your body, reduce the the adverse metabolism that occurs from having excess fat and an inflammatory diet, and reduce your risk of chronic disease, and improve your functional status, improve your fitness as you get older, in partnership with reducing your risk of cancer, heart disease, stroke, and dementia.